Hi, my name's Dr. Rachel Brown. I'm a research fellow in the Decipher Centre and I've worked with Graham on various evaluations and studies around e-cigarettes. So I'm going to talk to you today about some of the qualitative data from the studies that Graham has been presenting to you about. So just to start with a bit of background around where we are with e-cigarettes, they're one of those things that weren't really on the radar for anyone as recently as 10 years ago. There's been a fairly rapid emergence into the market. And with that has been quite high levels of experimentation among young people and underage use. So this has led to quite a significant amount of concern in policy circles around what we need to do about this, whether there are any harms to be particularly concerned about. What we do know is that the vast majority of use, as you've probably heard already, is actually experimental. So there's still little evidence of regular nicotine-based vaping among young people, but there are large numbers of young people that are actually experimenting with these devices. So this rapid emergence led to some concerns among policymakers about what this might mean for vaping in its own right, but also for tobacco smoking. So the real concerns were around whether e-cigarettes might actually act as a gateway. So whether they might be a kind of pathway for young people from vaping to tobacco smoking because of that nicotine exposure. And the other concern was whether the prevalence of e-cigarettes and the fact that they're kind of everywhere and they're easy to get and they're very visible would make young people feel like tobacco smoking was normal again. Because what we've seen in recent years is a significant growth in disapproval of tobacco smoking among young people. And that's obviously a positive thing in terms of reducing the likelihood of people taking up smoking. And smoking in public places is just not normal anymore. We've got generations that have never known smoking in restaurants, in pubs. So it's become denormalised in that sense. And the concern really was that e-cigarettes and that sort of visibility might make that look normal again. So the main policy response to that, the things that have happened in recent years, were firstly to raise the age of purchase from 16 to 18. So it is now in line with tobacco. And then there was regulation brought in called the Tobacco Products Directive, which I'll say more about in a second. So the data that I'm going to talk to you about today comes from two studies that we did to try to understand more about young people's perceptions of vaping, their perceptions relative to tobacco use as well. So how they looked at the sort of risk, how they think one compares to the other, and whether they have an understanding of the sort of harms involved. So there's one study around secondary school pupils where we evaluated the effect of national policy. And then another study in primary schools looking at perceptions of smoking and vaping. So as I said, the main legislation that was brought in was this EU Tobacco Products Directive, which came in 2016. And it gave retailers 12 months to switch from old non-compliant stock to new stock. And this was really the first attempt to regulate the e-cigarette market in a big way. And to kind of bring it in line with other regulated markets. It was a bit of a free-for-all before that. We didn't really know what was in the products. There were no requirements to label things in a clear way so people could actually tell what was in them. So the aim of the Tobacco Products Directive was to actually change some of that and regulate the market and make it much, much clearer. And it was very much with an emphasis on product safety. So these are examples of some of the new regulations that came in through TPD. So restrictions on marketing was quite a big one. So the kind of traditional media channels for vaping were just made unavailable. So you can't do that anymore. Any of you that's seen the packets for either e-liquids or devices, they now have a white box on with a health warning in, which says that nicotine is a highly addictive substance. And there's a requirement for that to cover 30% of the surface area. Those with high nicotine contents, the level of nicotine in liquids was regulated, so it was reduced from very, very high levels. The maximum is now 20 milligrams, and it goes all the way down to zero nicotine liquids. And larger refill packs for liquids containing nicotine were made unavailable. So just to be clear, this legislation didn't actually impact non-nicotine based liquids. So this was only those that were characterised as nicotine replacements. And at the same time as that, in the UK, we had the introduction of plain packaging for tobacco, which is obviously EU-wide policy. So you would have seen them, probably tobacco, switch to those kind of khaki green, very plain looking packets. That was part of this same legislation. And then a ban on selling 10 packs of cigarettes as well. So now the smallest you can get is 20. And for rolling tobacco, the smallest is the 30-gram packs. So they were some of the changes that came in around this time. And this policy was very much influenced by the idea that I mentioned previously about this renormalization hypothesis. So the idea that e-cigarettes might act as a gateway. And this is wording taken from the Tobacco Products Directive policy. So this was very much the kind of underlying principle. It wasn't necessarily based on data at the time saying that young people were using nicotine-based e-cigarettes in high numbers. It was based on this, very much driven by this fear of re-emergence of tobacco. So the idea that e-cigarettes can act as a gateway to nicotine addiction, and that then may lead to tobacco smoking. And again, this sort of idea that it's the mimicry, it's the normalization of seeing something that acts and looks like a cigarette. So we wanted to actually look at some of this through evaluation. So we carried out an evaluation of the Tobacco Products Directive from multiple perspectives. So we looked at the actual implementation among retailers, and we looked at compliance levels in stores. We spoke to local authorities and trading standards officers to talk about their experience of how the policy had been brought in, what they thought of some of the measures within the policy. And we also spoke to young people, and we did that over 2 time points to try to assess whether the policy had become more visible over time and whether they'd actually noticed any changes in the way that vaping was presented in the world in terms of advertising, labelling, etc. So this study took place across England, Scotland and Wales with multiple schools, and it was analysed, and the findings have been published, and those publications are out for anybody that wants to read in a bit more detail. But I just wanted to pick up some of the sort of key highlights that might be of interest. So what we found in terms of the secondary data is that vaping wasn't necessarily something that people were saying they were doing to seek out nicotine. And that was quite important. It wasn't necessarily the main driver for use. What people were telling us was that actually it was all about something that you do with your friends. So there was a very strong social motivation to pass a vape around in groups, to do this sort of socially. And it was driven mostly by fun. So it was very rare for somebody to say that they were actually vaping to meet a nicotine craving. And this was generally among young people that weren't smokers, so they were just doing that kind of experimental vaping that we talked about. Quite often, young people didn't really know necessarily if they were using a nicotine liquid. Some people were consciously choosing non-nicotine liquids, and that was a very deliberate thing to avoid nicotine. Other people just didn't know because it was passed to them by a friend. They tried it and they passed it on to the next person, but they weren't necessarily clear about whether that was a nicotine liquid or not, which is obviously something that we would be concerned about. But another very strong driver for this was the sort of trick culture on social media that was around. This is a couple of years ago now. And this was a huge thing. So young people doing vaping tricks, so creating the biggest smoke, creating patterns with the vape. And that took off quite a lot. There were lots of YouTube competitions. There was quite a big subculture that came around that trick stuff on social media. And that was quite important, particularly among boys. There was a big drive to get involved in that. Often those that were taking part in those trick competitions were actually not using nicotine-based liquids. So that was something it was about the trick, it wasn't about the nicotine. And flavours were hugely important. So the desire to try different flavours, the desire to sort of have the fruity ones, find your favourite, that was actually, again, more important than whether that liquid had nicotine in it or not. So the flavour was generally the key driver for using or not using. So it was very much about peer group dynamics and peer group behaviours and sharing this experience with your friends, more so than trying to seek out smoking behaviour. So we looked at this in terms of that question around renormalisation and whether we thought that this was evidence that e-cigarettes might actually normalise smoking again. And what we found is that young people generally didn't use the language e-cigarette. It was vapes and vaping was the predominant language. So there seemed to be a deliberate distancing of vaping and smoking. People were often very keen to stress that they were completely different behaviours. So they weren't necessarily seeing them as something that mirrored each other. I think when you look at the way vapes are now, we've moved away from that kind of the cigarette looking type that looks like a normal tobacco cigarette to the tank devices, the pods, now the disposables. So visually they're very, very different. And that was something that young people were very aware of, that they just don't look like the same kind of behaviours. We asked about adults vaping and what they thought of that, whether there was any sort of approval or disapproval of that. And it was generally seen as quite a positive behaviour among smokers to switch to vaping. It was seen as a good sort of health decision. So particularly where it was somebody that they knew in their family, they were generally quite supportive of somebody switching from smoking to vaping. There was still high levels of disapproval of tobacco use among self and among peers. So people didn't want to be around smokers on the whole. Most people didn't want to be exposed to tobacco smoke, and there was a high degree of knowledge around the harms of tobacco. That was a very, very consistent message. So we found evidence really that young people do differentiate very strongly between tobacco and e-cigarettes, which suggests that this idea of one making the other look normal again is less likely, because if they're not seen as being related or being the same sort of thing, that renormalisation is less likely to happen. And as I previously mentioned, we found that a lot of young people who don't smoke tobacco were using non-nicotine liquids. So it wasn't about them actually seeking out nicotine, which means the move then from non-nicotine liquids to nicotine-based tobacco is actually less likely to happen. We also found, and this was quite important in relation to the policy, that because of those sort of informal peer networks where they were passing them around between themselves, sharing them with friends, most young people had never seen vapes within packets. They were just something that you were passed by someone, which meant that that warning label wasn't actually being seen. So we reported on that because it suggests that that isn't going to be as effective as it might be. And in terms of advertising, there was very limited exposure to advertising messages for vaping. Where they had been seen, it was generally the shops on the high street, so you'd see the posters in the window and outside. But a lot of people did report seeing advertising on social media. And again, this was an issue because the regulations didn't actually cover and don't cover social media advertising. So there was some suggestion that that was the main source of exposure. Okay, so that's just a sort of snapshot of some of the secondary school data and the things that we found. So I'm just going to move on now to talk about some of the data that we found in primary school. And in this study, we spoke to school staff, we spoke to pupils and also parents. And we wanted to talk about awareness of vaping, perceptions of risk and perceptions of harm, and how that related potentially to tobacco use as well. And we were looking at primary school children's exposure to e-cigarettes and tobacco in the home and in other locations. So this, again, some of the headlines of what we found from this study, and again, there are publications in print for people that want to maybe know a little bit more about this. So within the interviews, we found that the messages around tobacco use were highly consistent between school and family. So we're just at that point basically where there's a very good understanding across society of what tobacco related harms are. There's consistent teaching that's been around in schools and on the curriculum for a long time now. So that message is very much embedded. Primary school children, on the whole, hated tobacco exposure. We had quotes of young people holding their breath when they walked past a smoker, of running past a smoker on the pavement to not be exposed to it. So there was a genuine fear of secondhand smoke grounded in what they've been taught about health harms. And the message between home and school was very consistent. So that meant that there was really high levels of disapproval of tobacco use among primary school age children. Just hated it on the whole. And in their world, they're from a generation where actually smoking is very denormalized. They don't tend to see it in high numbers. Lots of them didn't actually know an adult who smoked, which if compared to sort of 20 years ago would be a very different world. So that reinforced the idea of smoking just not being a thing that they do and not being something they would consider and something that they strongly disapproved of. And there was strong disapproval of smoking in teenagers as well. It was generally seen as something that the naughty kids did and something that they wouldn't do themselves when they went forward. When it came to e-cigarettes, though, the picture wasn't actually quite as clear, and there are good reasons for that, because the messaging around harms isn't actually the same as it is for tobacco. So there was a lot less consistency between the messages that that the children were being given in school and the messages that they were getting from home. We found that in some cases schools, because they weren't clear what to actually say around vaping and what would be the right kind of message, sometimes it was just being discussed together with smoking as equally harmful. And the challenge there is that that's actually not evidence-based. There isn't evidence of equal harm. We know that vaping is safer than smoking for health. And young people actually know that as well. So they're aware that if you don't have those powerful messages that you can have around tobacco and the sort of very strong visuals and things that you can have, it's not going to have the same effect. And sometimes this sort of presentation of vaping from schools as being equal to tobacco contradicted information that pupils were getting at home. Where parents who might have been ex-smokers who had switched to vaping, or a family member somewhere else, often grandparents who had been smokers who'd switched to vaping. This again was seen as a positive health choice, and it was being talked about in the family as a positive move. So this often contradicted the message from school that presented vaping and tobacco as being similar things. But we did find that actually both school staff and parents were quite concerned about what to talk about in relation to e-cigarettes, because it's not the same picture as it is for tobacco. We know for tobacco you can have those very hard-hitting campaigns, you can make the very direct links to cancer and multiple other health behaviours and health problems, but that's just not the same for vaping. There isn't that strength of message because the evidence just doesn't support it. So there was a feeling that it would be helpful to have some more guidance and think about exactly what schools could say that would be credible. So there were some of the headline findings from the primary school data. And this led us to really think about some of the key challenges and how we sort of move forward in this area. So one of the key points really is that issue of discussing vaping and smoking as being equally harmful. That isn't supported by the evidence, and there is a risk that the messages around tobacco and the messages around vaping become less credible. Young people have access to huge amounts of information themselves. They're generally pretty aware that vaping isn't the same. It doesn't have the same sort of risks for it. So there is that risk of undermining one message by presenting them as equals. There's a lack of clear data on vaping harms. The picture probably isn't completed, and obviously for anyone who's never smoked, the recommendation is that they simply don't vape. Nicotine is addictive, that is clearly a harm, but equally there are significantly less harms than smoking, and the evidence is quite clear about that. So again, it makes it difficult to construct a message and think about how you might actually present this to young people. But one of the concerns is that there's a risk of losing the actual health benefits of smokers switching to vaping. So we know the evidence is pretty clear, or very clear, that if a smoker switches to vaping, they will significantly reduce their risk of health harms. So among the smoking population, that's something to actually be promoted. We would prefer it if smokers actually switched to vaping from a public health perspective. So there's a risk of sort of presenting vaping as something that is actually dangerous and maybe losing some of that health benefit to smokers. So it has to be balanced really with trying to find a way to deter those who've never smoked from taking up or trying vaping in the first place. And we did find in some of the, like I mentioned, in particularly in the primary school, that kind of contrasting message between school and home was quite challenging for some young people. They were struggling to sort of interpret that in some cases, where they felt that stopping smoking was a really positive thing. And if vaping was a step towards that, that was actually seen as a good thing. So these are some of the sort of key challenges that we're left with, and there aren't really clear answers in terms of what schools can do to try to talk about vaping because of that lack of clear health message. The kind of typical way that we do these things in public health is to focus on health harms, and that often is the curriculum content. But it's not really the case that we can do that necessarily with vaping. What can be looked at, though, are things like those supply chains, so where there's a kind of playground culture of passing it around, where there are classroom behaviours where vapes are present. So that kind of approach to managing the space and thinking about what you do with them when they're on site. So we know that that's the pathway. We know that young people are selling them to each other. And these are things that can actually be focused on without any kind of risk around messaging. But yeah, I'll be around for the questions part of today. Just wanted to give you a kind of whistle stop of some of our data from recent studies. Happy to answer questions around any of this. And as I mentioned, we have publications out which you can find through the Decipher website if anybody wants to do any more reading. Okay, thanks for your time.